Guatemala is a country located in Latin America and the Caribbean and is classified as a lower middle income country by the World Bank. In 2012, 435,600 Dalis were lost to mental and behavioral disorders. In addition, cardiovascular diseases caused 270,600 Dalis to be lost, while digestive diseases contribute to 170,100 Dalis to be lost. The burden of deaths vary from age groups. For example, from ages 0 to 4, 5 to 14, 15 to 29, communicable diseases are the biggest contributor to death, but from ages 30 to 59, 60 to 69, and 70 plus, non-communicable diseases contribute to the burden of deaths the most.
In Guatemala, 435,000 Dalis have been lost to non-communicable diseases, with mental and behavioral issues having the most impact. Historically, a civil war occurred from 1960 to 1996, having lasting and traumatic effects on the population. Many of those who experienced or witnessed violence from the war have suffered from depression, post-traumatic stress disorder, and alcoholism. Aside from these disorders, citizens of Guatemala have also endured natural disasters, poor infrastructure, other illnesses, and financial concerns which could all affect their mental state. Alcohol is a leading risk factor for mental disorders and account for more than 5% of Guatemala's Dalis. The main reason for domestic and interpersonal violence in the country is men's consumption of alcohol, affecting mostly the women of Guatemala but also communities in general.
According to the World Health Organization, digestive diseases are the fourth leading cause of death in Guatemala. In 2012, 107.6 per 100,000 Dalis were lost to digestive diseases, with cirrhosis accounting for the most at 59%. Regarding the World Health Organization, this is 101,000 Dalis to be lost. Cirrhosis is a condition in which liver tissues are replaced by scar tissues due to major drug and alcohol abuse. In 2009, a health survey conducted in Guatemalan schools showed that 27.8% of people interviewed had consumed alcohol before the age of 13, and another 12% revealed they were dependent on alcohol. The Institute for Health Metrics and Evaluation reported diarrheal diseases as the third leading cause of years of life lost due to premature mortality. This is because Guatemala has only access to 64% of its water, and only 24% of that water is actually clean.
In Guatemala, cardiovascular disease continues to be the leading cause of non-communicable disease for both men and women. Non-communicable disease rates have continued to increase and surpass both rates of communicable diseases and injuries. It has been noted that approximately 5,500 and 5,200 male and female deaths of all ages were reported due to cardiovascular disease in 2012. Furthermore, Dali rates have continued to increase from about 244,000 back in 2000 to 271,000 in 2012. The main risk factor for this disease in Guatemala is urbanization. Many have migrated to the cities where many changes in lifestyle have occurred. Both men and women become more sedentary with new changes in work compared to the more active lifestyle they once had in their rural community. Serious public actions need to take place in order to decrease these risk factors that many Guatemalans face in the city.
For our interventions, we will be mainly implementing primary prevention techniques in Guatemala. It is also the most feasible way to help. Primary prevention is required to reduce and prevent illnesses and injuries before they occur. A common theme for our interventions is educating the population regarding healthy and safe habits. In Guatemala, liver cirrhosis accounts for the majority of the deaths caused by digestive diseases. So to reduce alcohol consumption, we will work with the government to increase taxes on alcohol. A law will be passed requiring all alcoholic beverages to have a warning label, similar to tobacco packaging. To combat diarrheal diseases, we will implement an ad campaign that promotes the use of soap. To overcome the increasing rates of obesity and cardiovascular diseases in Guatemala, we will implement an ad campaign teaching the population about the benefits of daily physical activity. Then, for children, mandatory weekly physical education classes will be implemented starting next year. To combat mental and behavior disorders, we will need to overcome stigma attached to these disorders. This can be done by providing education to youth and healthcare providers via mandatory mental health classes. Daily ads will be implemented to increase awareness and availability of social support groups such as Alcoholics Anonymous and religious groups.